Which of the following is not a risk factor for uterine leiomyoma? A. Smoking. B. Red meat consumption. C. Obesity. D. Family history. The answer is A. Smoking. The main risk factors for uterine leiomyoma are family history, obesity, and red meat consumption. Smoking is not a risk factor. Up to 90% of cases of pelvic inflammatory disease have what etiology? A. Human papillomavirus only. B. Neisseria gonorrhea E only. C. Neisseria gonorrhea E and chlamydia trachomatis. D. Chlamydia trachomatis only. The answer is C. Neisseria gonorrhea E and chlamydia trachomatis. 75 to 90% of cases of pelvic inflammatory disease are caused by Neisseria gonorrhea E and or chlamydia trachomatis infections. This condition, typified by adhesion formation in the uterus and fallopian tubes, can result in serious issues such as infertility, ectopic pregnancy, or reproductive cancer. Which of the following is part of the diagnostic criteria for pelvic inflammatory disease, PID? A. Fever. B. Leukocytosis. C. Elevated erythrocyte sedimentation rate, ESR. D. All of these. The answer is D. All of these. The criteria for diagnosis of PID are as follows: fever, cervical motion tenderness, abdominal pain, leukocytosis, elevated ESR, and purulent cervical discharge. What would be the primary concern in the case of rubella infection during pregnancy? A. Maternal ocular damage. B. Gestational diabetes. C. Birth defects. D. Maternal death. The answer is C. Birth defects. The primary risk in rubella infection during pregnancy is to the fetus. The rubella virus is able to cross the placenta, and acts as a teratogen by inducing apoptosis in fetal cells. This is termed congenital rubella syndrome. Birth defects can include deafness, ocular damage, cataracts, congenital heart defects, hepatomegaly, and developmental disability or delays. At what time during gestation is a fetus most susceptible to congenital rubella syndrome? A. The first 12 weeks after conception. B. Week 12 to 20. C. Week 20-30. D. Week 30 to 40. The answer is A. The first 12 weeks after conception. Infants who are exposed to rubella during weeks 0-12 of gestation have a 51% chance of developing congenital rubella syndrome. If the fetus is exposed to the virus between 12 and 26 weeks, the incidence of defects drops to 23%. Congenital rubella syndrome is rare in infants whose mothers were initially exposed to the virus after 26 weeks of gestation. Interestingly, the fetus is more likely to have birth defects if the mother contracted rubella before conception. Infants whose mothers contracted the virus 0 to 4 weeks before conception have as much as 43% incidence of congenital rubella syndrome, due to its long incubation period. Which of the following is the definition of gestational hypertension? A. blood pressure over 160/95 mm of mercury or rise of more than 30 mm of mercury systolic or 15 mm of mercury diastolic over baseline. B. Blood pressure over 140/90 mm of mercury or rise of more than 30 mm of mercury systolic or 15 mm of mercury diastolic over baseline. C. Blood pressure over 130/85 mm of mercury or rise of more than 35 mm of mercury systolic or 20 mm of mercury diastolic over baseline. D. Blood pressure over 140/90 mm of mercury or rise of more than 40 mm of mercury systolic or 25 mm of mercury diastolic over baseline. The answer is B. Blood pressure over 140/90 mm of mercury or rise of more than 30 mm of mercury systolic or 15 mm of mercury diastolic over baseline. Gestational hypertension is defined as a blood pressure over 140/90 mm of mercury or rise of more than 30 mm of mercury systolic or 15 mm of mercury diastolic over baseline. It generally develops after week 20 of pregnancy and returns to normal after delivery. Which of the following is not a part of the triad of gestational hypertension? A. Proteinuria. B. High blood pressure. C. Edema. D. Headache. The answer is D. Headache. The classic triad of gestational hypertension is high blood pressure, proteinuria, and edema. New onset headaches during a pregnancy that includes gestational hypertension may be a sign of a more severe condition, such as preeclampsia. At what point in a pregnancy is preeclampsia most likely to develop? A. 0 to 12 weeks. B. 12 to 24 weeks. C. 20 to 32 weeks. D. After 32 weeks. The answer is D. After 32 weeks. Preeclampsia occurs more frequently in the last 8 weeks of pregnancy. Occurrence at an earlier gestational age is associated with increased severity and poorer outcomes for both mother and fetus. Which of the following increases risk of ectopic pregnancy? A. History of pelvic inflammatory disease. B. Endometriosis. C. Post-tubal ligation. D. All of these are correct. The answer is D. All of these are correct. Ectopic pregnancy is a serious condition in which an embryo implants in tissue outside the uterus. Risk factors include pelvic inflammatory disease, tubal ligation, endometriosis, tobacco smoking, history of infertility, and the use of assisted reproductive technology. Which of the following is a risk factor for development of toxoplasmosis in pregnancy? A. Undercooked meat. B. Contaminated water. C. Exposure to cat feces, often via a litter box. D. All of these. The answer is D. All of these. Toxoplasmosis is a parasitic infection that is capable of crossing the placenta. It can cause birth defects such as hearing loss, learning disorders, and visual impairment. Toxoplasmosis infection is primarily a concern only in individuals who have never been exposed to the parasite before pregnancy, as most people develop immunity to infection 6 to 9 months after their first exposure, often through contact with cat feces in litter boxes or soil. The main routes of toxoplasmosis infection in pregnant women are exposure to cat feces, water contamination, consumption of undercooked meats, and blood transfusion.